Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello and welcome to Back into Alignment. My name is Joa Rivas. I am the host of this podcast that is released every Friday. I wanted to welcome you to a channel that we share information about spinal health. I am a yoga and Pilates teacher and I have two businesses. One is related to wellness and another one is related to real estate. This specific channel is related to wellness and health, especially for those that are experiencing neck pain and back pain. Very happy today. We are having a guest for the second time, Jono Taves. He's a physical therapist in the city of Colorado Springs, right in US, and he has actually a headache center. Yes, he actually has a headache center where he specializes to understand migraines. He also is the host of the Headache Doctor podcast. He specializes in understanding the underlying causes of migraines and headaches. And also, his goal and his mission is to live a life free of medication. This is so important. So you don't have to rely on medication to find the solution of migraines and headaches. I'm excited to having him again. I'm also excited to share with you one video that I created last year related to how to massage your jaw. If you are tensing your jaw, this could create a lot of pressure. So I actually have a video that I invite you to check in my YouTube channel. This video is about how to massage your masseter muscle right around your jaw with your thumbs. Very simple practice you can do in 2-3 minutes every day. And if you are snoring or clenching your teeth, you also can practice how to stimulate and how to release your jaw by exercising, opening your mouth wide, or perhaps doing side movements on your jaw. I do have these exercises in a video, very short video that you can just play and follow the instructions with me. And I am actually sharing with you this video. And I welcome you to check this video on the link on the chat notes, where I'm going to also invite you to check the 16-week posture program. This 16-week posture program for those that are actually having pain on the body, but they want to practice yoga and Pilates from home. And not only that, they also want to learn how to do a proper breath work anytime, anywhere, simply by becoming aware of the power and the tool that we have, and we have access, and it's actually breathing through the nose, nasal breathing. So this 16-week program has been launched for the last 7 years. It's been actually processing and learning so much. I learned so much with my students, and I welcome you to check the Posture School program. Is actually really interesting how our emotions are also connected to our spine. This is all connected through the brain connection. And also we have an anti-inflammatory nutrition that we offer as a way to learn nutrition that can take away inflammation from our body and from our joints. So before further ado, we're going to dive deep into migraines and headaches, and especially clenching the teeth today with physical therapist, Dr. Jono Taves. Hello, my friends. How are you today? Happy Friday and welcome to Back into Alignment. Another week bringing you health solutions, especially for those that are experiencing back pain, neck pain, and all these spinal health issues that are coming from many factors. We actually know that our body is the reaction of many issues that can happen to our emotions, perhaps, or to our physical body. And I am excited to bring you every week this podcast to share content with healthcare professionals from all over the world. And today we're actually having back Jono Taves, which is a healthcare professional in the city of Colorado Springs. He has a center that's called Headache Center. So it's actually, he specializes in headaches and migraines. And he's also the host of the Headache Doctor podcast. How are you, Jono?
I'm great, Joe. Thanks for having me on the podcast.
Thank you. Yes, second time. We had you last time talking about migraines and the common causes of migraines. A lot of people told me that they definitely felt all the consequences that can happen if you actually not paying attention on the underlying issues that we were chatting last week. And this topic is actually a broad topic that can only be understood by somebody like you. So please tell us a little bit about the Headache Center and the creation of this center, and how many people are working with you on the team.
Sure. Yeah. So we've been in business. This is year 5. So I feel like we're still just sort of making waves within our community, and then the community around the globe, actually. So we've had people from over 20 states fly out to see us. We've had people flying internationally, and then we work with a lot of people virtually. But a lot of our focus is in the Colorado Springs community here. So it's me and another physical therapist. As far as providers doing the treatment, we have a health coach that works with us, providing a lot of the virtual type of care that people get. And yeah, and we're looking to continue to expand and grow. We have people that find out about us from all over, and so we want to constantly improve our product in finding natural, non-medication ways to reduce the frequency and the intensity of these migraine symptoms that people have.
Yes, exactly. You believe that everyone deserves a life free from intrusive pain and unwanted medication, so that they can excel in everything that they do, and especially that we do. And I know how it is to have a headache. And like I was saying last podcast, the headache comes and attacks me when I'm not drinking water. So yeah, this is a reminder. Everybody, take a sip of water.
That's right.
Here I am, water. Sometimes we get so busy with our activities, phone calls, and then we forget to drink water. So we realize at the end of the day when we actually having the throbbing in our head. So definitely don't wait until the end of the day to have your water. So in terms of the water, do you have like a rule about how much water should a normal person drink?
Oh man, yeah, sometimes we get into the conversation of like nutrition and hydration. I'd say for the most part, what we want to do is sort of dissect the trigger that someone has. So dehydration, especially in Colorado, is going to be a something that pops up every now and then. We're at altitude; it's very dry. Staying hydrated is I would say it's less on the amount of water. I mean, I like those water bottles that have the I guess they're clear, you can see the amount of water you're drinking. But I would say you should be going to the bathroom about every hour. Okay. So if you're, yeah, that can be a good test for yourself. You should be getting up, going to the bathroom every hour. And that's a good way to keep you moving too. So if you sit at a desk, if you work at an office, just drinking enough so that you have to get up and move is a way to get you out of that static position as well. So that's a good rule of thumb.
Okay. And what about those people that are driving and they cannot really stop every hour, or those people that are back to back on meetings and they cannot take a break? What would be the way? Should we they just do like a sprints of a lot of water for a time and then?
Yeah, yeah. If you can't find your way to the restroom, yeah, I would say that you want to be mindful of your hydration. Usually, when people find themselves at risk of dehydration, it's if you're finding yourself thirsty, it's probably a little bit too late. And so, if you're not able to hit the restroom every hour, just be mindful of how much water you've consumed that day. Have a water bottle with you, and then just make sure you're not getting to the point of actually being thirsty, so that you can avoid that being a layer or like a trigger for your headaches or migraines. Whatever that frequency needs to look like for you.
Yeah, exactly. Totally a great point to start our conversation. And then we're gonna move back into that connection between our neck and our brain, and perhaps the connection between tightness in the neck and migraines. The neck is often the most likely underlying cause of pain, especially migraines and headaches. So one question that comes often is related to clenching the teeth or bruxism. Can you please give us a little bit of context related to clenching the teeth and migraines?
Yeah. So what we find is when people come to us with a headache or a migraine diagnosis, what we're looking at is this underlying neck problem. You can think of it as an injury in the neck that impacts the joints, the muscles, the tendons. And so the neck is going to function in a way where it's kind of compensating. So it's not as efficient. And like when you turn your head, look up and down, even the resting posture of your head on your neck changes. And when we look at resting position or like these compensation patterns, what happens is it pulls in other muscles to do work that maybe they're not intended to do. So throughout the day, these muscles are working harder than they should. And then resting position of the head can impact the jaw. If you think of your head, neutral would be midline. So if you think of a plumb line, your head should sit right in the middle. Oftentimes, when people have this neck issue, their head will be tilted one direction or the other. And because of the way the jaw functions, it's one solid bone with two joints, so a joint on either side, and it'll sort of shift in a sense because it wants to be in midline, but your head might be tipped one way or the other. And so those compensations that can result or sort of be downstream from this neck problem can impact the jaw. Now, there are jaw issues that can be the source that then can lead to neck tension. One of those being, let's say you have an underdeveloped jaw. So this can go all the way back to childhood, and your jaw should grow and develop in a way. And there's different reasons why it wouldn't do that. But let's assume it's a little bit underdeveloped and that is impacting your airway. Well, sometimes people have sleep apnea or a form of sleep apnea where they're having to thrust their jaw forward to open their airway as they sleep at night. And one of the things that can happen is you're sort of thrusting your head back to open your airway, your jaw thrust forward. And so what we see is the wear and tear will show up on their teeth. And so when you're sleeping, if you have an airway restriction or you're having to breathe through your mouth and thrust your jaw forward, we see that sort of wearing and tearing on the teeth themselves. In addition to that, I do believe that when people have a level of tension that's running through their neck, and it's just natural for that tension to translate into the jaw because of proximity and those compensations, that when it comes to resting at night, oftentimes those muscles have a hard time relaxing. And so they're kind of like trying to, they're trying to understand what their role is at night. They've been asked to do so much during the day. And so at night, oftentimes that tension just results in someone naturally clenching or grinding. And so resolving the tension during the day or managing that can really go a long ways to helping someone manage clenching in the evening.
Mm-hmm. So you were talking about the bruxism. That's actually the name. That is a condition that it could be grinding or clenching the teeth. And like you said, it could be happening unconsciously when we actually awaken. It happens to me a lot, and I have my partner, many times he comes and he's like, hey, you are clenching your teeth. And I don't even realize I'm clenching my teeth. But I guess the muscle is popping so much, like, do you just lose it up? So is this also a correlation between the clenching the teeth and being anxious? So do you have a perspective between these? Like, do we notice that the anxiety is increasing and then now people are really clenching the teeth even more than before?
Yeah, I would say if I'm gonna speak to anxiety and stress playing into this, if you're someone that clenches during the day, that is something to look for. The environment that you're in, whether it's at work, whatever the stress might be coming from, the mindfulness of stopping, breathing, thinking about tension that might be increasing through your jaw. So during the day, I would suggest that if someone is finding themselves clenching or biting down, that's never really a normal thing. I mean, outside of chewing, maybe in some circumstances, like a swallow would require you to bite down. But for the most part, your mouth, your teeth shouldn't be touching. Your teeth should be slightly apart, your tongue resting on the roof of your mouth. And so if you're not in that position during the day because of some stressful situation, it's it's really a matter of just being mindful, because you can still control that stress to an extent, like the physical stress through your body, even though the situation you're in might be stressful, or the anxiety that you're having might be leading to that, because we do see hormonally these things impacting the amount of like physical muscle tension through the shoulders and the jaw and that sort of thing.
Yeah, so we do have awake bruxism, and then we have a sleep bruxism. It happens when we're sleeping. I do have been wearing my front teeth, and my dentist recommended to me to wear a mouth guard to avoid this issue. But I think it comes more from the way as I'm sleeping, perhaps I'm not having my head properly aligned with my spine. So can you please tell us a little bit about the proper way of sleeping to avoid clenching, or this is something more of a unconscious pattern that our body has been adapted?
Yeah. So yeah, I would say two things. One is there's definitely a way to sleep that reduces the amount of stress through the neck and through the shoulders. And so I recommend avoiding sleeping on your stomach. Side sleeping is okay as long as you have a pillow that you're hugging and one in between your knees, because you want to avoid sort of the pseudo stomach sleeping position where your top leg is bent, your bottom leg straight, so you're twisted in some sense. You want to avoid that. So having those additional pillows is a good way to keep you on your side. And then side sleepers need a thicker, like memory foam or a foam type pillow, so it's going to hold its shape and really support your head. Because when you're on your side, you got to account for the width of your shoulder.
Okay,
And then,
so for that pillow that you say it's sideways, is there a specific length of the pillow that you recommend for the support of our knees and the shoulder? Is it that one that looks like for the pregnant woman, which is a long one, and which one are you actually telling us?
yeah, those pregnancy pillows are great. I like, like a body pillow is probably an easy one because it's one pillow. You're not having to deal with two. Throw pillows work great to like hug because they're usually thicker, and so it'll support your arm fairly well. And then a thinner pillow usually works fine in between your knees.
Or your husband and wife, perhaps?
Yeah, exactly. Your spouse.
Well, good luck with that. We definitely generate much heat in the night, and we tend to hug our partners, and within less than an hour, we will notice that we tend to find our own space because we definitely generate heat in the night. So I think that's a great idea, my friends. For those that are listening to the podcast, let's try to either use your pillows that you have right now, or maybe purchase one of a body pillow to avoid twisting the spine or the shoulders of the position. And the other point about the sleep, it is related to the apnea that you actually commented before. So is this related to malfunction on the breath? Or what would be the main factor that is affecting the function of the breathing patterns?
Yeah, I would say if someone has sleep apnea, I mean, in our sort of Western medical model, it would lead them to get a CPAP, which is just going to force air. But what we want to do is actually look at the airway itself. And so this isn't necessarily a specialty that we go into, but we check to this to some extent to refer people to a specialist. But it can be something either as invasive as a corrective surgery to increase like your nasal passage, like a deviated septum, to just expanding the upper palate, which is the base of your nasal passage, through something like orthodontia. And so the other thing is the tongue is shaping the jaw as we develop and grow. And so the tongue pushing up against our upper palate should sort of allow the palate to go from high and narrow to shallow and wide, which will expand the airway. And so if someone's having an airway issue and they're having to breathe through their mouth, there is a level of training, just retraining someone on how to breathe through their nose that can be done. But sometimes they actually have to improve the actual space or increase the actual space of our nasal passage so we can breathe through our nose. A good way to test that is you should be able to close your mouth and and breathe through your nose for about at least 5 minutes without having to like open your mouth and gasp for air. And but if you want to take it further, I mean, it would be getting a sleep study and understanding if you actually have sleep apnea, like if you're waking yourself up because you can't breathe.
Yeah, or snoring. I know snoring. We see this happening even in newborns. Newborns are snoring, and this can actually generate an issue having mouth breathing. We had probably 2 years ago, we have an expert. She is a dentist, but she's actually a specialist in tongue posture. Very interestingly, she actually brought us to a different spectrum of the lens of dentists. I never imagined in the dentistry finding a dentist that is specialized in tongue posture and releasing the tongue, and also working about nasal breathing from the beginning of the human development. Really interestingly, she was actually giving us information how her kids had crooked teeth, and she could not understand why her teeth had the teeth were crooked. And it happens that there is this effect when women are breastfeeding their kids. If the babies, if they're not really aware of the position of the neck, breastfeeding their babies, this could actually affect the passages of the breath, and plus the position of the tongue palate. So all what you're commenting is actually super interesting how is being explored by so many doctors, especially on the dentistry field. Now, if for those that are actually curious about learning about breath, we do recommend you a book that was written by James Nestor that is called Breath, the New Science of a Lost Art. And as a yoga teacher for almost 20 years, I constantly encouraging people to learn how to breathe, especially from the nose, because we actually are connecting to our parasympathetic, which actually relaxes our vagus nerve. And this will actually help you to be calm and to reduce the anxiety. So this is all connected together, right, Jono?
Yeah, absolutely. The our body has all these systems that are functioning and coordinating and communicating with each other. So tapping into the autonomic nervous system and getting like calming down that fight or flight response and kicking in the rest and digest is a great way to, yeah, it's that mindfulness and breathing, and there's huge benefits to all of that.
Yes, it is actually surprisingly interconnected. Our breath with our emotions, the way how we are actually positioning our bodies, it could be a consequence of all this. So it's actually super, super interesting. Now, about clenching the teeth, is this a common malfunction that you see on people nowadays? Or have you seen that it's an incremental on the clenching the teeth? And is this something that you really see that is a link between clenching the teeth and migraines?
Yeah, I would say that probably 80% of the people we see were working on their jaw to some extent. If you're in your 30s, 40s, 50s, and have had migraines for an extended amount of time, we're probably going to be addressing some dysfunction in the jaw, tension in the jaw. And so there's a strong connection there, especially just the correlation or the connection between the neck and the jaw, the proximity of the muscles, the anatomy itself, the joints, and their interaction with each other. It's just so closely tied together that it's hard to have one issue without the other. And so our different types of headaches can have a stronger connection to the jaw itself. If you have temple pain, if you that can be the temporalis muscle, which is a jaw muscle, can be irritated or agitated. If you wake up with headaches in the morning, oftentimes we're going to look at clenching or grinding or jaw issues, jaw tension as a direction for treatment, because we want to know if you waking up with headaches is a result of that clenching or grinding. And so, yeah, in the headache and migraine world, looking at the jaw, understanding that it's a big deal because it's a big aspect of care that these patients are needing.
Yes, yes, yes. And then let's say if I come to your center, headache center, and you notice that this is kind of one of the main factors that is influencing into my migraines, what would be the behavioral change or some type of exercises that I could start implementing to be able to reduce this tension around the jaw?
Yeah, honestly, we if it's something that really needs attention, we might send someone to go through what's called myofunctional therapy, which is retraining them how to breathe, how to swallow, improving lip strength, so that you can actually close your mouth, breathe through your nose. So that's a part of it. Is we want to train people to breathe through their nose. The other thing that can be done is just that mindfulness during the day of relaxing your jaw, understanding the resting position of your jaw. Your lips should be closed. Your teeth should not be touching. Your tongue should be resting on the roof of your mouth. And in addition to that, it's just range of motion. So a lot of people have maybe a disc issue or something that prevents them from opening all the way. Sometimes it takes a level of treatment, a few sessions to get them to open all the way, but then we want them to use their range of motion. And then it's kind of specific to each patient, but oftentimes we'll need to correct or put them in a certain posture and then just practice opening. But something that everyone can do is use a mirror to practice opening and closing your jaw in midline, because there's something to just the motor memory of your jaw knowing what midline is. And I would imagine a lot of people, if you look in a mirror and you open and close, you might have a little deviation to the left or the right. And so just practicing opening and closing in midline can be helpful.
Okay. Yeah. So basically, if you're listening to this podcast and you're not driving and you're just kind of comfortable, you perhaps can try to open your mouth and close, and that will start stimulating the muscles and maybe stretching the muscles. The other way I suggest to my students in the posture program, actually, because the jaw, the teeth are connected to our cervical, which is interconnected to the entire body, especially the cervical is connected to it's like the atlas of our body. So it's really important. It's the base and really supporting our brain. So it's sideways. So something that we normally don't do is like to move our jaw sideways. So you can just kind of like set your timer for 1 minute, 60 seconds, and really bringing awareness into that area on your jaw, and then do like a sideways. And then like Jono was saying, opening and closing your mouth. Same with the tongue. You can like, we do in yoga this breath called fire breath with the tongue out. This also will stimulate your vagus nerve. I know you want to look very, very, very silly, but why not to laugh, right? It's nothing wrong to laugh about how silly you could look with the tongue out. But all this is actually practices that are implementing into the release of the tension on our jaw. What about like heat? Do you find like placing a compress, heat compress to like kind of like loosen up a little bit like that? Would that help?
Yeah. So with tension, heat can definitely help. I would say it's going to change. Like if you have pain in your jaw, if the joint itself is hurting, heat can definitely calm it down. And then if you're trying to like do a warm up in a sense before you go through these exercises, heat might help. In a sense, like get the jaw lubricated, warmed up, that sort of thing. But honestly, oftentimes it's sort of used as a pain management element because it's calming. People like heat. And so what I tell my patients is if you like it and you try it, great. But if you put heat on your face or on your neck and it doesn't really do much for you, that's fine too.
Mm-hmm. Do you like the use of night guards?
Oh, night guards? Yeah. So I have mixed feelings on night guards. In one sense, they're great to protect the teeth if someone's clenching or grinding. Oftentimes they can have fractures that like microfractures on the teeth themselves, or they can have cavities that pop up because they're clenching. And so the night guard can protect against that. Sometimes the night guard is a quick way to like change someone's bite so that when they bite down, their teeth are contacting each other, and that can be a little bit helpful. So I've had patients where the night guard is needed and it helps. I've had other patients where they use their night guard and it's not helpful. I do think with a lot of patients, we want to get to the underlying problem, which if they do have an airway issue, we want to figure that out. And so I would probably say the night guard's helpful, but we might want to take it one step further with a good percentage of people we work with.
Yes, it's also like hard because if you're actually wearing a night guard, perhaps this will stimulate more of the biting, since your body is like, what is this? I'm just want to bite it. And the feeling, it may actually create more of the activation. So I'm also not too into a crutch. I'm more into like the awareness about what's happening and why am I actually clenching. So yeah, I also understand you. Thank you so much. Believe me, we have spoken now for almost 30 minutes about clenching the teeth. So literally this topic could be very extensive, and I'm sure we can talk more about this area so much that we're going to have you again next week. So Jono, tell me a little bit about February. How do you see this month in terms of your community? I know you have masterminds where you actually master classes where you're actually educating the community through exercises that anyone can do it at home. And for those people that actually don't have the access to go to Colorado Springs to meet you, you also have a course can be taken on any time, anywhere in the computer. So tell us a little bit about how we can find you.
Yeah, well, noveraheadachecenter.com. We do health coaching combined with our master class, so people get the education they need to understand where their headaches or migraines are coming from. And then we have them work with our health coach, who does an amazing job of creating goals, changing habits, things that are really going to impact your day-to-day life. And you can see a dramatic improvement in your headache and migraine situation as well. And then, of course, in person, we love to get patients locally, flying in from out of state. We know that this is a big problem, and so that's always available to people. And yeah, that's every now and then we'll do webinars as well. So if you get on our email list or if you interact with us, we can on social media, TikTok, Instagram, Facebook, we can get you the info for any upcoming webinars that we'll have.
Yes. Remember that the mission of Jono Taves is actually to bring solutions to break free from a life of pain and dependence of medication so that you can thrive in everything that you do, especially headache free. Why not, right? That this is a big one. Awesome. Yeah, thank you. This is great, and especially for people like my mom. They're always experiencing back headaches since she's a child. I wish I can take her into your clinic to see one of the reasons what could be happening to her. There's a lot of factors that we're going to be continuing sharing with you. But first, we would love to hear your feedback after this conversation. If you have the headaches, please let us know. Where do you feel the headache? In the front, on the side? If you apply one of the strategies that we were talking, please tell us what works for you, because all this information actually helps so many other people that are listening and reading the comments. I am super excited to have you again next week. And we wanted to send a shout out to your clinic that is doing a great contribution for the people. And also saying hi to your family. I know you are a father of two and you're also serving in the church and the community. So I know you are very engaged with the people in Colorado. I definitely have to take a trip to visit your center and meet your team. But for now, have a beautiful day. And remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.